Hello, welcome to Dadpuzzles Podcast. We are so happy today. We're joined by a very special guest, Dr. Amruti Borad. She's osteopathic family medicine physician and also a certified coach. So we have all the help that we need today as dads. So we're very happy. She has a deep commitment into the well-being of the physicians and their families. She brings a unique perspective to our discussions, and she will be sharing the challenges that one can face in terms of balancing their career, their family, and their personal growth. So we really look forward to that, and I think we're going to have a conversation that's going to be filled with wisdom and practical advice. So welcome, Dr. Bora, to our podcast today.
Thank you so much for that very kind introduction, Dr. Ijani.
Thank you.
And I appreciate you having me on your show.
Can you share a little bit about your background so that folks can know, who you are?
Yeah, sure. My name is Amruti Borad, and I am a concierge osteopathic family physician. And I grew up in Southern California. I come from a family of immigrant parents. I have two siblings. I'm the middle child. And strangely, all of us are in medicine, even though my parents aren't. And I think they essentially really wanted us to find a career that's both fulfilling and provides for financial stability. And we just all fell into it. And I ended up doing an accelerated program through my college and medical school, osteopathic medical school, because I wasn't a very good test taker. And I learned about these accelerated programs that don't require you to be the best of the best in terms of test taking,
Mm-hmm.
but also it provides you a way to skip a year of college and then go straight into medical school. And osteopathic medicine at the time, I think it was just starting to become more popular, and it was about the time when East-West medicine was becoming more popular. And although osteopathy is not necessarily considered alternative medicine, it gathers some of those qualities. And I found it to be very interesting. So I ended up choosing that program with Western University of Health Sciences, Mona. And I went to Pitzer College, which is the school right next door. And I ended up deciding on becoming a primary care physician after realizing that I was going through all these rotations, and I just really liked everything. A little bit of everything. I love relationships with families, long-term relationships. I like to know what happens. And there's just so much flexibility with primary care in general. So I knew that it was the right fit. So I went to family medicine. I went to UCLA for my residency. And then I stayed with UCLA for several years in academic medicine because I was teaching at the university and I was teaching in my clinic, my third year students in my clinic. And then I got married and I moved to San Diego and I ended up with UC San Diego. So I stayed within the UC system and I essentially was in a practice that was more focused on patient care and efficiency. We didn't really have teaching involved. And through that time, I worked on being a COVID lead physician for our department. I was a clinic medical director, and then I was a wellness director for our department. And I found all of that to be very fulfilling in ways, but I think also with that on top of patient volume rising, especially in primary care, especially after the pandemic with all the shortages of physicians, essentially I burned out twice, once during the pandemic and then at the heat of the pandemic and then short and maybe another time after that. And I knew part of me wanted to leave medicine, but I ended up working with a coach and realized that's not what I wanted to do. I wanted to find a new way to treat patients. And I ended up joining a concierge practice with UC San Diego. So it's a hybrid. You're with the big university, but you do concierge medicine. And I've found that very fulfilling. And I also became a coach myself because it helped me so much. And I wanted to help other physicians like myself and medical students to try to be preventative. And so now I'm in the concierge practice and I also coach.
Oh, that's beautiful. And also, I think from knowing your history, you're also like you're a new parent yourself, correct?
I am. So that adds another twist to the story. I just had my daughter, my firstborn, in October. So I'm currently on maternity leave. And I've been very grateful for that too. because every university or every job has their own policies, and I'm able to take 5 months off and not worry about my patients
Mm.
and that sort of thing. I have a really good team that's taking care of everything while I'm gone. So yes,
Oh,
that
that's
I don't know what it's going to be like when I go back, but right now, just learning
mhm.
how to be a new parent is very humbling. Yeah.
Absolutely. As a healthcare provider and a new patient, I'm sure what
Mm-hmm.
advice would you share to the new dads that are either going to be or their first time going through this period of being just a parent for the first time? Well,
Yeah, that's a good question. It's funny. I my one of my friends, I was talking to her about this a few days ago, and she said that men are not hairy moms.
hmm
I just thought that was so funny because
hmm
we expect our partners, our male
hmm
partners, if we're talking about heterosexual couples,
right.
to be a specific way, like to feel everything that you feel,
hmm
and you're not going to. It's just hormonally, even it's just not there. It's a
Right.
different feeling completely.
hmm
So I think whether you're becoming a father by accident or you planned it, I
hmm
think something that's the most helpful is just communicating with your partner what
hmm
they need from you. Some couples, it's going to every OB appointment. Some, it's
hmm
just the most important. Others,
Right.
that's not important to them, but just asking, what do you need, especially in the pregnancy period. And I think towards the end of pregnancy, everybody's pregnancy is different. And for me,
Right.
it was towards the end that it was really physically difficult.
hmm
So helping in that way, household tasks, that's a big one. And
hmm
then afterwards, it's the same thing.
Right.
It's a whole change for both people.
Right.
And the communication again is very important, knowing that when we ask you to do something, it's not meant to be considered harsh. It's just a
Oh,
directness.
bossy.
Hey, I
Right.
need help.
hmm Right.
Again, it's that communication piece, and all families do things differently.
Absolutely. Okay. Thank you. Actually, that's what I was going to ask next in terms of, let's say, what do you advise for both you and your partner to really address the issues? I guess this is it, the communication. Absolutely.
Yeah, so I think one thing is, I think for me personally, I'm a planner.
hmm
My husband's
hmm
also a planner. But
hmm
this is something, and I tried really hard to plan, read this book and
hmm
read that book and read this
hmm
newsletter for my
Right.
husband to help a little bit. And I'm in medicine, he's not. And so I come from a different understanding. Like I'm very medical and clinical, right?
hmm
But this is something that you really can't plan.
hmm
There's only so many things you can plan for ahead of time. So I do think that reading certain books can
hmm
help just to get you acclimated to what it might be like. But in the end, when it comes up, when it actually comes time to, okay, now we have a baby,
hmm
it just changes everything. So it depends on what is your baby like. My daughter had a lot of colic and reflux, and now she's 3 months old, so things have gotten better. But that
hmm
was a really hard time, and he's not on paternity leave. He's also working, and had to be away for work for a lot of the beginning parts of this. And I know a lot of people deal with that. I have patients, especially like in the military, for example. A lot of the times, parents are separated for significant periods of time. So for me, it's really just doing what you guys think works best for you. So some people will, if you're not breastfeeding
hmm
the whole time, do night shifts, right? Like you take care of the baby this night, I take care of the baby this night, or this week and that week. Some people will say split up the weekends. It's Saturdays for me, Sundays
hmm
for you. For us, it's just worked to just touch base every day throughout the day. And can you feed the baby a bottle while I pump? Even simple things like that. Or can you watch her so I can go to the grocery store or go get my nails done? And we've been very lucky that we have my mother in law very close by. And she's been very helpful too. Like, can you come over and watch the baby like she is right now?
Awesome.
So it's really the communication between the parents,
Awesome.
but also knowing when to ask for help is
hmm
important.
Absolutely. Absolutely. Thank you. Can you share a little bit about how you ended up doing the transition from academic medicine into concierge? I know part of it you mentioned was about burnout. Was there anything else that really prompted you to look into concierge medicine?
Yes, I. It's funny. heard about concierge medicine for a long time, and I had negative connotations about it because, of course, you do have to pay a fee. So concierge medicine is you take
Mhm.
insurance, but then on
Mhm.
top of that, you have a yearly fee usually to have access to your doctor. So that will limit the population that you're going to take care of. And direct primary care, which is cash only, that's a that's also a newer way of take. I'm sure it's been around, but it's something that we talk about more now. And that's a way to address certain patient populations where it's not going to be
Mhm.
so expensive.
Mhm.
So I always thought it was celebrity medicine, but the more I looked into it, and when I started to experience it, I realized that, oh, I actually get to take care of my patients the way that I want to.
Mhm.
And originally, I was going to transition into a part time job at a different hospital
Mhm.
that was similar to what I was already doing, seeing patients every 20 minutes, 10 hours, let's say 9 to 10 hours a day was my schedule.
Mhm.
Um, and so I was going to do that. And then I learned about this position or was offered this position and started talking to the medical director there. And she mentioned, oh, you get an hour with your patients. You get to 2 hours with your new patients. You
Mhm.
have the support from our APP team. And it just sounded like a dream. And when I
Uh,
started doing it, it
mhm.
really is. It's not for everybody,
Mhm.
but it's so much more manageable. Our patient panel sizes when you're and part-time, and patient panel sizes are about 200 versus I think I was at 1600 before. And I know at
Right.
other institutions like 2000, 3000 is what they expect of their
Wow.
full-time physicians.
Right.
So this has really helped me
Mhm.
really take care of patients because it's about building a relationship, being able to
Mhm.
communicate with them, and then
Mhm.
having the time to learn. And they continuously learn, right? That's what medicine is about. Things are changing
Right.
all the time.
Uh,
So, yeah, it was the burnout that prompted me initially, but then actually looking into how the practice works. And every concierge practice is different, but
mhm.
I'm very happy with the way ours functions in terms of patient care and support.
Okay. Okay. Now, you've been being a family medicine physician. It gives you this unique perspective of a family. So, what can you share about fatherhood and family life? What's your understanding on that?
Yeah, so it's interesting because I've seen a lot of couples,
Mhm.
and men and women are very different in terms of how they take care of their own health and also their understanding of their children's health if they have children. And yeah, we were talking about fathers, so yes, children.
Mhm.
I've seen, for the most part, it's usually the mom that comes in with the kids, right? If
Mhm.
the dad's coming in with the children, usually he has a list from the mom or the mom's on FaceTime. And I would totally do that too if my husband was, taking the baby, just because it's part of it is like a control thing, but
Mhm.
also just my experience with pediatrics as well.
Mhm.
I think just having the father being involved in the patient's care, whatever it
Mhm.
may be. It might
Right.
not be always I'm taking you to the doctor, but
Okay.
being involved in other ways. Are you
Right.
involved in their activities? Are you taking interest? Are you having dinner together as a family?
Mhm.
What is your relationship with your spouse?
Mhm.
How are you communicating with them? How is that affecting your children?
Right.
And just knowing as a father, men don't like to go to the doctor, but
Mhm.
as a father, taking care of yourself is really taking care of your children, because
There
if
you
you're
go.
not around, you can't take care of them.
Absolutely. Oh, thank you. Thank you. So you mentioned about the long-term relationship. You like to have that with the families. So how do you see the role of fathers in maintaining the health and the well-being? I know you mentioned about we should not forget ourselves. We should really also prioritize our health. Anything else you suggest for us?
Yeah, so I think one, yes, prioritizing your own health. So you're making sure you go to your yearly physicals.
Hmm.
And if you have a problem, that you're coming into the office and discussing it. I think mental health is also very important, and men don't talk about that very
Hmm.
often.
Right.
So coming in to discuss that as well with your primary care doctor, because there's so many things that we can do to help you
Hmm.
find the right resources, talk you through
Right.
the issues. And because you're not talking about things, we know that your family life affects your mental health. Being able to just speak to somebody about how are you feeling as a father, for example.
Hmm.
And then in terms of other advice, again, just
Hmm.
being involved in your children's care. And it does not have to be, I come to every doctor's appointment. Every
Right.
family is different and structured differently.
Hmm.
But having open communication with your children, especially nowadays with social media, being
Hmm.
able to being able to have this line of communication with your children where they
Hmm.
don't feel afraid to talk to you about things. I think that's probably one of the most important things is being able to be almost a friend in a way with your
Hmm.
children.
Oh, nice. Absolutely. Thank you. And also, you being a life coach, that's a big step. Can you elaborate on that? Because you're trying to help the future docs and also the current physicians right now.
Well, sure. At first, the focus was physicians like myself
Mhm.
because that's something I'm very familiar with. I just had gone through it myself. But interacting with medical students, I realized that the lack of mentorship
Mhm.
is quite prevalent. And
Mhm.
just even finding a mentor, finding one that, you know, understands where you're coming from or has the same interests as you or is somewhere in life that you want to be can be very
Mhm.
difficult because you have to have that commitment between two people. And
Right.
especially in primary care, it's just really hard because everyone is just so busy and burnt out.
Mhm.
And we want to set an example for students. But just after interacting with them and like really thinking about how I felt as a student and how much I would have benefited from having a coach and mentorship or mentors are different things. They're very
Mhm.
similar. So I do coaching and mentoring of students to be preventative for the students because
Right.
our whole hope is to have more doctors that are fulfilled. We don't want
Right.
somebody who's just burnt out and then they're going to quit medicine a year into it or 5 years into it.
Right.
So that was my primary reason for wanting to work with students. And then the other end of the spectrum, which is like our mid-career physicians in
Mhm.
medicine for 10 plus years, and it's just becoming too much. The patient volume, the paperwork, the EHR, our electronic health record system, lack of flexibility in hours, not being paid as well as you should as a primary care doctor for everything that you're doing, which that is changing a lot. But just looking
Mhm.
at in general, how do we
Okay.
keep our physicians who have been working that long, how do we keep them in medicine and making sure that they feel fulfilled about what they're doing?
Okay. And the next question I was going to ask you, say, with your experience during the pandemic, I've seen that you have learned to seek for help when you need it. For example, with a burnout, and also that has led you to change into the whole career from academic into concierge medicine. Anything else that you have learned during this time?
Mhm. Yeah, so I think if the pandemic had not happened,
Hmm.
I'm not sure. I think that burnout may have happened. I'm just not sure. Maybe in a
Hmm.
different way. I think it would have
Right.
happened in a different way and maybe later.
Hmm.
But I think something that I really learned is really coming from a place of understanding what role did you play in your own burnout and what role is the system playing in the burnout. And you can't change a system overnight, but you can change yourself. Not
Hmm.
overnight, but you
Hmm.
have control over that. You might
Right.
not have control over what the system is doing. But
Hmm.
if you do what's in your control, eventually the system will change. And we're
Right.
seeing that everywhere with more and more communities of doctors coming together. So I
Hmm.
think stepping back and understanding like what is in my control, being able to ask for help, ask for what you need and not being afraid to, because the worst that can happen is they say no. And
Hmm.
the things that I asked for, I didn't get everything that I wanted, but that's
Hmm.
not the point. The point is you ask for what you need, and hopefully, even if they say no,
Hmm.
you basically essentially learn what you needed to know about that
Right.
situation and decide how to move on from there or accept it.
Hmm.
And then also setting boundaries in terms of how you spend your time or
Hmm.
what's being expected of you.
If you can provide the tips on how we can achieve this work-life balance. I know this is a big, everybody's talking work-life balance, and some people actually they denounce the whole issue about balancing. But so far, what's your insights on this?
Work life balance. Yeah, I think a lot of people think of it as okay, having a healthy diet, exercise, sleep. Those are all things that are necessary, but I don't think
Hmm.
they're enough. Going out and getting a massage, that sort of thing.
Hmm.
I've been listening to a podcast
Hmm.
and reading a newsletter called Parent Data, and there was a psychiatrist that came onto the podcast saying that
Hmm.
self care is not lighting. Essentially, self care is not lighting candles. But what I love, what she said was that self care is doing what brings value to your life, like what is important to you,
Hmm.
whether it's just for that day or if you're
Hmm.
thinking months ahead, the year,
Hmm.
what do you actually value, and make time for that. and
Mm-hmm.
that is helps you create the balance in your life. So I really like that. And again, of course, sleep, diet, exercise, those are all
Right.
necessities. You can't skip those things,
Mm-hmm.
but that's not the whole story.
Okay. That's beautiful. And also, can you talk a little bit about the whole quality, this issue with the Six Sigma black belt issue with preventing the burnout? Can you talk about that
Yeah,
in terms of the
so
strategies?
so the Lean Six Sigma, that was it. I think it indirectly helps prevent burnout, and I'll explain why. So the lean methodology, for people that aren't familiar with it, it's really
Hmm.
just a way of figuring out how to provide value, how to be efficient by
Hmm.
removing wasteful practices.
Right.
And it's also about continuously improving. There's nothing that's stagnant, it stays the same forever.
Right.
Constantly reevaluating your processes.
Right.
So I had gotten into that working on two different projects using these lean methodologies.
Hmm.
And my first one was actually working with one of our registered nurses in the clinic I used to be in and figuring out like we call it the rock in my shoe, what's
Hmm.
really bothering me and how is it going to
Hmm.
affect patient care. So for me, it was controlled substances
Hmm.
and controlled substance prescriptions, refills,
Hmm.
and how
Hmm.
quickly are we actually able to refill them? What policies do we have around them? So that
Okay.
led to, it started off with just let's try to refill these prescriptions within 24 hours. And then
Hmm.
it led to a whole other process of let's use our electronic health system to help with that. Let's utilize our staff, our medical
Hmm.
assistants to help us with that.
Okay.
And then let's set expectations for patients in different ways and also for our colleagues when we're covering for each other. So I think for me, at least for me,
Hmm.
having those policies in place, it really helped me with communication with patients that have chronic pain
Right.
um, and are on any controlled substance, really. So that was
Hmm.
one project. And I think being able to communicate with your patients and not have this huge burden can really help prevent the burnout.
Absolutely.
And then the other project I worked on was educating physicians on how to bill, what would happen if you did that. And although the focus was monetary, like how
Hmm.
can you financially support your institution ongoing by
Right.
teaching these physicians how to bill
Right.
appropriately. But I
Hmm.
think it also, a big part of burnout is physicians feeling like they're not being compensated for the work that they're doing, right?
Hmm.
There's a lot of peripheral work that we do that just no one sees. The
Right.
average doctor is spending 2 hours after their workday charting or working on other things. We're spending weekends. We're on
Right.
vacation. We're checking our messages, right? Providing value to them. If we can educate you on how to show you how can you be compensated appropriately for the great services you're providing, I think that's really important. That's a huge part of preventing the burnout and being able to financially sustain your institution. If you cannot have a good financial foundation, then
Hmm.
you can't help all the people that you're trying to help.
That's
So
good.
that's how I use lean. And I hadn't thought about it that way. I know
Hmm.
you asked me the question, but I
Right.
hadn't thought about like how does it actually, how did what I had these projects, how did they actually also help with burnout? And now I know why.
I'm sure they appreciate you because, for instance, the whole issue with documentation and such, which is like in medical quality, which is what I'm involved also, by them just putting some time to know and do better, it saves them a whole lot. And also, even their
Yeah.
report cards will look better by them doing a better job on that end also.
Yeah, exactly. So there's always a sense of what's in it for me, right? And I understand that. It used to frustrate me, but I actually understand again, if
Hmm.
we don't all work together, we
Hmm.
cannot have a good financial backing and therefore provide good services to our patients.
Absolutely. Absolutely. And also, I remember before the 2 midnight rule, I was doing the medical necessity denials, and some of the inner city hospitals they will close down because the insurance companies will pay them for, let's say, if a patient stays in the hospital for 10 days, they get
Mhm.
paid only 2 days or sometimes no days. So I was able to defend them through level one, level two. Sometimes it goes all the way to the judge,
Yeah.
but the medical necessity portion was very important, but also the physician has to document the documentation. So I know it's a whole mess. But thank you for what you do. We truly appreciate you. So in your role of wellness, you being the director on that. So, what initiatives did you have that helped your fellow healthcare professionals?
Yeah, so I was previously a wellness director for my department.
Hmm.
And in that process, I learned a lot. I worked with someone from our human resources team. We paired together
Okay.
and we created a business plan to show what are we losing when physicians burn out and leave. And I
Okay.
think the very commonly quoted numbers are you
Hmm.
can lose up to $1 million per doctor just to
Hmm.
replace them because they left due to burnout. So trying to figure out how do we actually calculate that? How can we actually show that? And the whole team we were working with was able to figure out for our institution, or for our department, it was close
Hmm.
to $500,000 to replace a physician if they left. So
Hmm.
that's the financial piece to show what this is doing. And then the other piece was really figuring out a program. So we came up with what we would do weekly, a lot of the time, or even daily. So daily, I
Hmm.
created a way of a patient experience
Hmm.
tips. So every morning we
Right.
would do these patient experience tips, and I share them with all the clinics in our department.
Hmm.
And then monthly, we would have these in services where we're bringing in different people related to wellness,
Right.
someone with meditation, someone with
Hmm.
occupational health,
Right.
talking about these topics. And then we would do every 3 months, we'd have a social gathering, or we try to with the pandemic going on. And then addressing more like what we would call like the clinics that might feel overburdened, like going there in person and talking to
Hmm.
them about what their needs are. And then
Hmm.
our leadership started having meetings, I think once every 3 months, where it was
Hmm.
just an open forum where you can talk about the leadership team can explain what's going on.
Right.
And then we can talk about what problems we have. And then supporting our physicians with the electronic health record. So we had two people that were very tech savvy, and
Right.
they would meet with all of our new physicians
Mhm.
during the orientation, and then they would also meet with us individually if we wanted to help us, and I think that helped a lot too. So those are
Mhm.
a lot. Those were some of the bigger initiatives that we took on, and
Mhm.
then we decided, okay, what are we trying to target? Our
Mhm.
KPIs or key
Right.
performance indicators,
Mhm.
and then we were able to show that in certain realms we were doing well,
Mm.
and others there was a lot of room for improvement. So
Absolutely.
moving forward, we figured out a plan for, okay, what areas do we want to improve on. And then at that time, I had left the department and someone else had taken over. So it's morphed,
Right.
yeah, through time, but I still think it's been a great success.
Mhm.
And the person that's doing it now is actually an occupational health physician, so it's perfect for this.
Right. Mhm.
And they've continued doing newsletters and social events.
Mhm.
So I think just building that community, letting physicians know what resources you actually
Mhm.
have at your disposal for
Right.
free most
Mhm.
of the time. I think that's really important. The community and being able to communicate what the
Okay.
concerns are, having open, honest communication.
Okay. So I'm trying to marry that into how can fathers learn from that experience? I guess you'll be seeking help, like joining like men's groups and such, signing up for newsletters with the Dad Puzzle, for instance, or seeing you for coaching advices. Hopefully, if they're in the healthcare, correct?
Yeah. So essentially, I think, yeah, as you hit the nail on the head, which is making sure you're asking for help,
Mm-hmm.
right? So men, we look at the statistics, and women do um, burn out a higher percentage than men for various reasons.
Mm-hmm.
But part of it is also that men don't ask for help.
Mm-hmm.
So if you're feeling like you're burnt out, and that's being emotionally exhausted,
Mm-hmm.
feeling like starting to feel cynical, not being able to have that empathy, and then
Mm-hmm.
feeling like this lack of personal accomplishment, that no
Mm-hmm.
matter what you do, it doesn't matter. If you're starting
Right.
to have any of those symptoms, you do want to reach out for help. And every organization has something, especially nowadays, has
Mm-hmm.
something to help you
Yeah.
in terms of whether it's therapy services or getting a coach. And a lot of men feel, of course, comfortable with male coaches, but it really
Mm-hmm.
doesn't matter. Sometimes it's nice to have the female perspective, and just really just talking through what
Mm-hmm.
the concerns are, because we have a lot of working fathers and fathers in medicine, and a lot of them might be specialists that are
Mm-hmm.
away from their kids for longer periods of time, if they're proceduralists, for example. So
Mm-hmm.
really learning how to balance your life, and if you feel like it's out of balance, knowing who to ask for help.
Right.
and getting those resources. And I think newsletters are very helpful. They just come to your in basket or your
Right. Right.
inbox once
Mm-hmm.
a week or daily. And
Right.
then podcasts are a big thing. And
Mm-hmm.
listening to those, I think, can
Mm-hmm.
help too.
Oh, fantastic. Thank you. And also, you as a coach, sometimes we have those inner demons or just try to reach our potentials. So, how can you help us as a coach to navigate those challenges, like whether it's personal or professional?
Yeah, so I think with coaching is really about collaborating with somebody else to become very clear about
Mm-hmm.
what they want. What are their goals? What are they
Mm-hmm.
struggling with? And tapping into their inner wisdom, essentially.
Mm-hmm.
You have the answers, you just need someone to help you find those answers.
Mm-hmm.
So I think a lot of what happens in life, of course, there are certain circumstances, if you change them, it might be
Mm-hmm.
better. It just depends on what it is. But
Mm-hmm.
typically speaking, it's really what you think about your circumstances that's going to drive the results that you have in your life. So it's really about, okay, how do I change how I feel about something or how I think about something in a
Mm-hmm.
way that will allow me to move forward in my life, create this positive belief system, having thoughts that serve you and
Okay.
instead of ones that don't, can help
Mm-hmm.
you build this belief system and help you essentially channel that belief system to have
Mm-hmm.
whatever it is that you want, whether it's having very strong relationships with your
Mm-hmm.
children or your
Mm-hmm.
significant other or
Okay.
your colleagues, your boss.
Mm-hmm.
A big realm of it is relationships, but also
Okay.
what are your big goals? And a lot of the times, like you said, it's really your mind that
Mm-hmm.
prevents you from doing that. So trying to figure out how to do the proper thought work, I
Okay.
think, is what coaching really helps with a lot of the time.
Okay. Awesome.
Yep.
You being from the Indian origin, for instance, can you share a
Yeah.
little bit about the culture? Because I want us to learn as dads, because we have dads from India, dads from China, dads from Africa, from South America, from everywhere. So maybe we can start with you today, for instance, from the traditional gender roles and such. Can you talk a little bit about your background and how that can affect or make us as dads learn from that and maybe do better so that we don't affect you as your wives?
Yeah, it's a great question. My husband is white. He's not Indian. So I don't
Hmm.
have that personal experience in that way.
Right.
But my
Hmm.
parents and their generation, a lot of them are arranged marriages. My parents were in arranged marriage.
Hmm.
And yes, there were traditional gender roles. Like typically the wife my mom worked until up until she had children and then helped my dad with his business, but most of it was primarily taking care of the children. And
Hmm.
so there's continues to be, even though it's gotten a lot better,
Hmm.
I think from that generation, they see things in a specific way, and then they're
Hmm.
teaching their children a specific way, and
Right.
then they're growing up and having their own families.
Right.
So I think in the modern, if we're going to think about like modern Indian couples,
Hmm.
I think we've moved a lot, even though I've seen, depends on the relationship, even
Hmm.
though I have seen where, again, the woman is giving up the career to take care of the children, but it's more
Hmm.
by choice, by discussion, rather than just an expectation.
Hmm.
But I think that just knowing that it can also be the dad that does that. So
Right.
it's being able to have these almost like fluid
Hmm.
roles as
Okay.
husband and wife. And
Okay.
then also like knowing that, okay, my parents might have done something a specific way, but
Hmm.
that doesn't mean that I have to do it that way. Times have changed. I think it's so essentially, although I don't have personal experience like within my own relationship, I did see it in my parents and their generation. And I do
Hmm.
see with a lot of friends who are Indian couples being influenced by what their families did and just really being able to separate the two and treat your
Hmm.
relationship as just that. It's like our relationship and we are two people. It doesn't need to be, we don't need to follow all the cultural norms. Like we can take what we liked about it and
Hmm.
infuse that and then change the other
Right.
things.
I think that's beautiful, and also to maybe to live in that moment and see, okay, how what's our situation? Because sometimes mothers can be overwhelmed, so we need to know, or maybe to be told about this, so that we can be helpful.
Yeah, absolutely. So again, it's a communication
Hmm.
piece as well. I think as women, we assume that it's never good to make assumptions. You
Right.
just
Right.
have to communicate directly. This
Hmm.
is what I need. I'm feeling this way. And
Hmm.
then figuring out a way to, in your, kind of figure out, okay, I can help you with these things. I
Right.
can't help you with this. How
Mm-hmm.
can we get you help for that? So it might be like, oh, we need childcare, for example.
Mm-hmm.
And if you're working full time, you're not going to be able to do that. So, okay, let's bring in either a family member, or let's bring in a
Mm-hmm.
nanny, or let's talk about daycare. Like
Right.
figuring out all of those pieces,
Right.
I think is important. And so, again, and also a lot of the times as a woman, we want things to be done without asking, which again is also something that's not always going to happen. So sometimes, like when you start to learn as a
Mm-hmm.
spouse, like you start to
Mm-hmm.
learn, okay, what does the mother need? And you start to see a
Mm-hmm.
pattern.
Right.
Doing things without being asked, I
There
think
you go.
helps a
That's
lot too.
awesome. That's awesome. Thank you so much. I truly appreciate you. And do you have any question that you can share to the next guest about fatherhood?
Yeah, I guess my question would be, I would really like to know, based off of what I'm saying, what
Mm-hmm.
is the male perspective of that? What is your perspective as a father? How do you feel about being a father in all the
Mm-hmm.
different stages? In the beginning,
Mm-hmm.
the children, our babies, are not communicating with you, so it's really hard to bond. But just knowing different, like fathers, different perspectives on, did you bond with your baby when they were really young? And if you
Mm-hmm.
did, how did that happen? How did that come about? And how did you support your spouse? Or how do you think you can support your spouse?
Right.
And what are you doing to take care of yourself? And how do you feel as a father?
Mm-hmm.
I'm a woman, so I wouldn't know that.
Right.
So
Right.
those kinds of perspectives would be
Be
interesting.
helpful. Okay, fantastic. Thank you. I'll be posting that to the next guest that we have as a dad, so that we can hear the
Mhm.
perspective on that. Thank you so much. Thank you.
Yeah.
So truly, you being on that puzzles today, we have you have provided some really valuable insights, and we truly appreciate you, and your journey and dedication is definitely like much appreciated. Like many medical students, they need you. Like even the current doctors, you have folks that have been going through this blindly. They don't have like a dad or uncle or something, but they did not even seek help from people that are ahead of them. They were just doing it blindly. And what I was one of them. It's really good to seek help by seeing a coach like yourself. So thank you so much. I'll be sharing your information as well. Is there a way to for them to reach you if they're interested?
Yeah. You can just go on my website. It's vorcisphysiciancoaching.com.
Okay.
And there's a contact form, and you
Hmm.
can let me know that you're interested. And we just set up a free consult and talk about what are your goals for coaching or what brings you to coaching.
Hmm.
And then we go from there.
Oh,
And you can also find me all over social media, but the website kind of puts everything together.
fantastic. Thank you so much. Please tune in for the next episodes on Dad Puzzles for more engaging episodes like on fatherhood and personal growth. So thank you so much, guys.